Pseudolymphomas are a group of benign conditions that can mimic lymphoma, a type of cancer that affects the lymphatic system. They can cause confusion in diagnosis due to their similar clinical presentation and histological features. This lecture will focus on four common pseudolymphomas of the neck: Kawasaki disease, Rosai-Dorfman disease, Castleman disease, and Kikuchi-Fujimoto disease. Kawasaki disease is a systemic vasculitis primarily affecting children, often presenting with fever, rash, conjunctivitis, oral mucosal changes, lymphadenopathy, and extremity changes. Cervical lymphadenopathy is a common feature, often tender and bilateral. Histopathology shows nonspecific lymphadenitis with follicular hyperplasia and reactive changes. Rosai-Dorfman disease, also known as sinus histiocytosis with massive lymphadenopathy, is a rare non-neoplastic proliferative disorder of histiocytes, often presenting with painless cervical lymphadenopathy. Bilateral cervical lymphadenopathy is the most common presentation. Histopathology reveals characteristic enteropoiesis, where histiocytes engulf lymphocytes, plasma cells, and other histiocytes. Castleman disease is a rare lymphoproliferative disorder characterized by localized or generalized lymphadenopathy. Cervical lymphadenopathy is common, often painless and unilateral. There are two main subtypes: the hyaline vascular variant, characterized by hyaline vascular structures within the lymph node, and the plasma cell variant, characterized by a proliferation of plasma cells. Kikuchi-Fujimoto disease, or histiocytic necrotizing lymphadenitis, is a self-limiting benign inflammatory disorder primarily affecting young adults, often presenting with fever and cervical lymphadenopathy. Painless cervical lymphadenopathy is the most common presentation. Histopathology is characterized by karyopexis, or nuclear fragmentation, and a starry sky appearance due to apoptotic debris. In terms of differential diagnosis, lymphoma is a malignant proliferation of lymphocytes, often presenting with painless lymphadenopathy. Infectious lymphadenitis, caused by bacterial, viral, or fungal infections, can also lead to lymphadenopathy, often associated with systemic symptoms and local inflammation. Management varies by condition. Kawasaki disease is treated with intravenous immunoglobulin and aspirin therapy. Rosai-Dorfman disease typically requires observation, as most cases resolve spontaneously. Treatment for Castleman disease depends on the subtype and severity, ranging from observation to surgery or chemotherapy. Kikuchi-Fujimoto disease is usually self-limiting and requires no specific treatment. In conclusion, pseudolymphomas of the neck can be challenging to diagnose, as they can mimic lymphoma and other benign conditions. Understanding the clinical presentation, histopathological features, and management of these conditions is crucial for accurate diagnosis and appropriate treatment.